Welcome to Simplify Pharma. To subscribe to my channel to stay updated with the latest videos. In this lecture, we are going to talk about pulse oximeter and what is its importance in COVID-19 crisis. The COVID-19 pandemic has sparked a sudden interest in the humble finger pulse oximeter. It is a medical device that let people check their oxygen saturation levels. Today we will discuss about the small handheld unit which can tell us about the saturation of oxygen in our blood when normally attached to a finger. This product can be found at many pharmacies, supermarket stores and also on many online sites. Now, before understanding working mechanism of pulse oximeter, we need to understand the concept of oxygenated and deoxygenated blood. Here we can see this is a circulatory system. As we inhale oxygen, the oxygen it enters the lungs and then it is passed into the blood. This oxygenated blood is pumped into the heart and then the heart pumps this oxygen rich blood to the various organs in our body. Later, the veins collect the blood from various parts of the body and this blood is rich in carbon dioxide. That is why it is called as deoxygenated blood. The deoxygenated blood is pumped back to the heart and from there it is passed to the lungs where it gets again oxygenated. Coming back to pulse oximeter. A pulse oximeter is an electronic device that can be clipped onto your finger to measure the heart rate and oxygen levels in your red blood cells, that is RBC. It means how much oxygen the hemoglobin in blood is carrying. Now over here we can see this is how the display of pulse oximeter looks like, wherein this reading is the pulse rate reading and this reading it shows the oxygen saturation. The main way oxygen is carried in our blood is by means of hemoglobin. In simple terms we can say hemoglobin molecules, they are the cars as we can see over here, and the blood vessels, they are the roads. The oxygen molecules, they get into these cars and travel around the body till they reach their destination. Let us take a look at the use of pulse oximeter. It is usually known to be used by athletes, mountain climbers, pilots, or anyone involved in high intensity activity, and also in hospitals on patients to keep tab on their body oxygen supply. I will be covering only the aspect of measuring oxygen saturation as this is of concern for COVID-19. Pulse oximeter uses light to find oxygen saturation. The light is emitted from the light source which goes across the pulse oximeter probe and reaches the light detector. Now, if a finger is placed in between the light source and the light detector, the light will now have to pass through the finger to reach the detector. Part of the light will be absorbed by the finger and the part not absorbed, it reaches the light detector. So it uses the principle of Beer's law, that is the amount of light absorbed is proportional to the concentration of hemoglobin in the blood vessels. By measuring how much light reaches the light detector, the pulse oximeter knows how much light has been absorbed. That means more the hemoglobin in the finger, more is the light absorbed. Here it also uses the Lambert's law, that is, amount of light absorbed is proportional to the length of the path that the light has to travel in the absorbing substance. In addition to these, the pulse oximeter makes use of another important property to calculate the oxygen saturation. Hand. The hand has a network of arteries and veins. While arteries carry blood from the heart that is rich in oxygen, which we can call as oxyhemoglobin rich blood, and the veins, they carry blood without oxygen rich hemoglobin back to the heart, which is called as deoxyhemoglobin. Oximeter makes use of this property of oxyhemoglobin and deoxyhemoglobin, which absorb light of different wavelengths in a specific way. That is, oxyhemoglobin absorbs more infrared light than red light, and deoxyhemoglobin absorbs more red light than infrared light. This light source sequentially passes light of different wavelengths through a sample of oxyhemoglobin. The pulse oximeter detector works out the oxygen saturation by comparing how much red light and infrared light is absorbed by the blood. The pulse oximeter computer takes these factors and computes the saturation. One of the major concerns is the timely detection of COVID patients, especially if they are asymptomatic or before the symptoms occur due to further acquired comorbidity or subsequently acquired infection within the infection period. First, let us understand what is the reading which are considered safe or of concern in an accurately reading oximeter. As per the American Lung Association, a level above 95% is considered to be normal. Anything below that level would be a reason to go to a doctor, and under 90%, this level would be a reason to go to the emergency room. Silent hypoxia occurs in some COVID-19 patients. Hypoxia is a condition in which blood oxygen saturation levels are exceedingly low, indicating they are not getting enough oxygen to their lungs. Yet, these patients do not show symptoms of breathlessness. Here, people look and feel comfortable and they don't notice any shortness of breath, but their oxygen levels are dangerously low. We need to fight coronavirus in this purple zone. So, in the previous slide, we saw this zone is considered as the normal zone, wherein the value is more than 95. If it drops below 95, it is considered as subclinical zone. Below 91, this is the detection zone, and below 88, this is called as the danger zone. If the value drop anywhere in the subclinical zone, we should consult the physician as soon as possible. It may or may not be accompanied by a symptom of shortness of breath. If the value drops in this detection zone, there can arise a need of supplementary oxygen. And if the value drops in this danger zone, there can arise need of ventilation support of ventilator, and it can also lead to failure of various organs and ultimately death. The values shown here are for a healthy young individual, and they may differ according to age and other medical conditions. Hence, one must not panic on comparing with the values shown. That is to understand that for individuals with medical condition or for all old people, the normal zone values, it may shift a bit towards the subclinical zone. However, the concern must arise if the values drop towards the detection zone. A pulse oximeter could be useful for those with a number of underlying conditions such as asthma, congestive heart failure, or chronic obstructive pulmonary disease to keep a check on their health condition. But for everyone else, there is a concern that it can add an anxiety component. The device may just be an unneeded source of anxiety. You might check and keep checking every hour and worry upon what you will do if the number is low. You should check thrice a day, morning, afternoon, and before going to bed at rest. Remember, it is also an instrument and will have its inaccuracies sometimes, and it is also important that you are measuring it when you are at rest. Even pulse oximeters at hospitals have been known to deliver inaccurate results. One can still go the route of something is better than nothing and have one. What is reliable and what is not? As of now, there is very little standardization of this product, and you are buying in good faith. A number of variables offer SpO2 features that use your smartphone's camera to deliver SpO2 measurements. It can be a hit or miss. Such technology has not been cleared by the FDA. There are also many tutorials on how to build your own pulse oximeter. All these must be considered with caution, as they all may not be reliable and they may be unapproved methods. Meanwhile, shortness of breath and low oxygen levels are just two possible symptoms of COVID-19, and it's important to know all of the symptoms. There is a list of symptoms that could appear anywhere between 2 to 14 days after exposure to the virus that causes COVID-19. That list includes cough, fever, shortness of breath, difficulty in breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, and loss of taste or smell. And at last but not the least, listen to your body and stay alert for symptoms such as dry cough, fever, and shortness of breath. If you feel lethargic during a period of usual activity such as showering or getting dressed, that should raise an alarm. Thank you.